Hi, Kinesiology 1018. Welcome back for Chapter 5, Part 2 on low back pain and low back health. So today we're going to talk about preventing and managing low back pain because it happens to more than 85% of Americans, especially over the age of 50. Okay? And it's one of the most common ailments in the United States, along with things like our other chronic diseases. But pain is one that sticks around, and you notice it a lot more than you may notice some of the other chronic diseases like developing heart disease. And it can come from traumatic injuries, or it can come from weak and inflexible muscles, poor posture, poor mechanics when you're moving, like lifting and carrying things. So it can happen over time, and it can happen from one specific incident. So let's get into what's going on at the back, especially the low back, and why it's causing pain. Okay, first we need to understand some of the structure of the low back or of the spine in general. We have vertebrae, which are each individual bones that move down the spine. Each in between has an intervertebral disc. So this is a ring of connective tissue, fibrous connective tissue that can help absorb some shock and allow some motion for our spine. Okay, so these, think of them as like little bushings in between the vertebrae to help us have some movement and keep some stability and to have some shock absorption for everything that's coming down above it. Okay, with our nerves, however, nerves run through the spinal column, which goes within the vertebrae. Okay, and we have 31 pairs of spinal nerves that branch off through the spaces between the vertebrae. So we see here there are these spaces between the vertebrae. We have nerve roots that send out through there. And these nerve roots send signals out and send signals back, and if we cause some kind of damage to those nerves, it's going to cause pain. Okay? Our erector spinae, however, is a muscle that runs on the back side, okay, behind the spine, and attaches to the vertebrae and helps to keep our vertebrae in line. Okay, so think about it as our backside abdominal muscle that controls our posture. Okay, if you have poor erector spinae control and erector spinae strength, you're going to have poor posture, and you may have more risk for injury to those nerve roots, those nerves, those intervertebral discs. Okay. So the purpose of the spine itself is to create support and structure for the body, okay, protect the spinal cord, and then give us attachment points for muscles, ligaments, tendons, and help us create some movement so that we can move our head, interact with our environment, move forward, backward, side to side, spin, and move our trunk. Okay. With our spine, we have four major sections. Okay, the first section is the cervical curve or the cervical vertebrae. We have 7 cervical vertebrae. Okay, so think about these as our neck. Okay, then we have 12 thoracic vertebrae, or this is our upper back. Think of these as our rib vertebrae. So each of our thoracic vertebrae have a rib that attaches to it. Then we have our low back, okay, which has 5 lumbar vertebrae. So there's 5 vertebrae in the low back where there is only muscular attachments that hold these together. And then we finally have the coccyx, which is 9 vertebrae at the base of the spine that are fused together and attached to the pelvis. Okay. So what we see here is a point where there is very little structural stability, a lot of structural stability with the rib cage, a little structural stability with the lumbar vertebrae, and a lot of structural stability with these fused bones and the pelvis. So it's more mobility, less, more, less. And this allows us to get all of these crazy movements that we can do in our spine, but it also leaves especially the cervical and lumbar vertebrae at risk for injury because we need muscles and connective tissue to hold them stable. Okay, how we remember our curves and how we remember how many vertebrae we have is we use the clock when we go to Denny's. Okay, we go at 7 for breakfast, 12 for lunch, 5 for dinner, and then we come back at 9 for a milkshake at the sacrum. Okay, so we can remember when we hit each vertebrae based on when we would go to Denny's. That's my fun way to remember all of our vertebrae. But when we think about it, the most commonly injured vertebrae are the cervical and lumbar. And what we'll focus more on are those lumbar vertebrae, because that is our low back. Okay. These intervertebral discs at this lumbar vertebrae are holding up about 1/3 to 2/3 of your body weight, okay, compressing these vertebrae. And then we have these nerve roots that are going through and out. If we damage those vertebrae, or if we damage those discs, it's going to cause pressure and pain on each of those individual roots. Okay, so our spinal cord goes through the center, which would go straight down the middle, and those nerve roots would come out the sides. Okay, our vertebral body is where we support that weight. So that's that thick circular area here in the center, okay, where our intervertebral discs are located. Okay, we also have each of these individual notches where the roots come out of, and each of these processes or bony protrusions where we have muscular attachments so that we can cause motion or resist motion at the spine. With our core musculature, okay, those muscles that stabilize the lumbar spine specifically, our core muscles or our trunk muscles are there not to cause very much motion, but to resist motion. If we can resist motion at the lumbar spine, we can keep it stable. So that's the job of our abdominals, our obliques, our erector spinae, our gluteal muscles, our other upper back muscles to give us more structural stability around that lumbar spine. And if we have weak core or trunk musculature, we are at risk for low back pain. Okay, so because dynamic movements, okay, could cause damage if we don't have the muscular strength to stop movement, hold on to positions, lengthen and resist motion. And then these also send us signals about where we are in space. And if we don't understand where we are in space, or we don't have coordination of these trunk muscles, we're more likely to put ourselves in a position to have an injury. Okay, so we need to stabilize that lumbar spine, because we don't want something like this, okay, where we have degeneration, we have inflammation. Here is a bulging disc here, if you can see that. That bulging disc causes inflammation, which also pushes on the spinal column. If we're pushing on that spinal cord, it's going to send a signal to our brain that it hurts, that there's pain. So we want to not let this happen by keeping ourselves safe. How do we keep ourselves safe? By resisting things that may cause injury. Okay, prevention is the key. It's not about finding what can fix it after it's hurt. It's about preventing it from ever hurting in the first place. Okay, we can do this by improving the muscular endurance of our core musculature. And we can keep a good posture where our upper back or upper cervical curvature, our cervical curvature, thoracic curvature, and lumbar curvature are where they should be. So I'll adjust my seat right now to make sure that I'm in a good quality posture while I'm talking to you. Okay, we want to be in a good lined up posture. We don't want to be up here. We don't want to be down here. We don't want to be rounded forward, okay, going to the side, leaning, okay, turning. We also don't want to have excess body weight. Okay, excess body weight, especially around the midsection, okay, around the belly, okay, or that belly fat where we have a large abdomen. Okay, that is also going to change our posture, because now we have a bunch of weight hanging out in the front of our body that's going to cause our low back to extend too far. And if we don't have other musculature to stop that from happening, it's going to cause wear, tear on those discs, and it's going to cause injury in the long term. And then when we're moving around, we need to have good body mechanics. Okay, so this individual here who's trying to pick up this box, he has a rounded lumbar spine problem. Okay, he has a forward shoulders problem, and that box is really far away from his feet problem, and he's not bending his knees. That's a problem. If we're going to pick something up from the ground, we want to bend our knees, we want to flex our hips, okay? We want to squat down with a good posture, brace our core musculature, so squeeze them tight, like someone's going to come and punch you in the stomach. Keep that object very close to your body, and then use your legs to stand up without moving your spine. That is our best way to have good quality trunk mechanics when we're picking up an object. Okay, so you should be practicing that all the time when you're picking up even a piece of paper off the ground. How we do one thing is how we're going to do everything, so do everything as well as we can. Okay, we can also do things like reduce smoking, reducing stress, avoid sitting or maintaining the same position for too long. Okay, we want to move. Movement, movement, movement. Once you stop moving, that's when we see issues. So maintain a change in position. Okay, if you're sitting down for longer than about 30 minutes, you should probably stand up. Okay, create a supported seat or put a lumbar support while you're driving or sitting for a long period of time. Put something in your lumbar spine to help support that posture so that when your abdominal muscles get tired, it's going to help give you more stability. And then whenever we're doing some kind of activity, warm up first and progress your resistance or cardiovascular training. Okay, jumping right into resistance training above what you are capable of doing can put you at a risk for injury. Okay, so let's talk about, what about acute back pain? What if something happens where you are hurt in maybe a car accident, you fall? Okay, what we first want to do is relax the tissue or put us into a relaxed state. So using something like cold or heat to reduce that pain, allow you to relax. Okay, and then also call a doctor. Okay, if it happens in a short period of time, it's major pain, call a doctor. Okay, if you have acute pain, you relax, you recover, and it goes away. Think about those activities that you're doing and then maybe make some adjustments so that that activity doesn't happen again. Okay, what about chronic back pain though? Chronic back pain is something that persists for 3 or more months. Okay, this could be stabbing, shooting, aching, stiffness. Okay, these are all types of chronic back pain. Okay, some treatments would be over-the-counter prescriptions, exercise, physical therapy, things like acupuncture or electrostimulation, and then also improving posture, lowering total body mass, and improving body mechanics, and in worst case scenario, surgery. Okay, I do recommend exercise, as you can see in about 3 of those options of the 7 options I have up here include some kind of movement-based intervention, and exercise is written twice. Okay, move, 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 move. If we don't move, we have a problem. And if we don't move through different ranges of motion, create control, we have a problem. If we have too much body mass, we have a problem. Okay, so what are some exercises to prevent low back pain? Okay, first of all, we want to do them at least 3 days per week and focus on muscular endurance. Okay, we want our core muscles to be able to work all day so that we don't have any kind of pain or don't have a risk of pain. Okay, and then most of these exercises should be stability based. So focus on stability, not motion. So don't try and do a bunch of really big twists. Try to resist yourself from twisting. Okay, resist yourself from bending forward, going backwards, going side, going side. Okay. Do other activities also. Don't just do these, but do things like cardiovascular endurance, especially if you are at a higher body weight. If you have a lot of fat mass that you don't want to have on your body or is causing some back pain, lowering your weight or lowering your body fat is going to improve your back pain. Okay? You're not going to have as much back pain. Okay? And then one of the big ones here is it's not no pain, no gain. It's if you have pain, you're doing something wrong. Okay, so we don't want sharp, acute, stiff pains while we're exercising. Okay, we don't want to feel pain. We want to almost feel a relief of pain. Okay, and then we want to build stabilization and reduce our weakness in our low back. Okay, so we want to do things that are stabilizing activities. Okay, so we can do different stretches. We can do different tilts. We can do different trunk twists. Anything where you're really trying to maintain position. Okay, the side plank is one of my favorite ones. Okay, that resists side-to-side motion. Or a back extension, which resists your bending forward, which helps you improve your posture and especially improve your gluteal muscles, and your erector spinae muscles. Those are some big ones for me. And then we can do the big three. So these are an additive onto your class. These are the big three by Stu McGill, Dr. Stu McGill. The modified curl up, which you put your hand under your back and you are lifting your chest off the ground. So we're trying to smash our hand and lift our chest off the ground very slightly. So this is working the abdominal muscles, teaching us control on the front side. We do our bird dog or our side bridge or side plank where we're going off of our knees, lifting our body up, holding position and coming back down. And then we have the bird dog where we go opposite sides. So left arm, right leg, extend them out while you're in this all fours position. Extend out, come back and try and keep a level, neutral spine position. Just do them nice and slow, all of these. I would recommend 3 sets of 10 every day, multiple days. If you have low back pain, try these out. Try them in 1 set a day, then try to move up to 2 to 3, and then to multiple times throughout the day. Maybe you do 2 sets of 10 twice a day. That's still 4 sets a day. You're going to get stronger. You're going to build some endurance in your core musculature, your trunk muscles, to help you resist low back pain. So try these out. Okay, test them out, see how they feel. They're going to be difficult, especially the modified curl up and the bird dog. Those two are going to be very, very difficult, but practice, practice, practice. They're going to help you in the long run. All right, thank you very much, and I look forward to our next lecture.